Hi, everybody. I'm Chris Keating, Chair of the Ethics Committee. So, what we'll do today is we'll talk about a case that will frame out a fellow's predicament, and what we'll do is we'll then discuss the different ethical angles that are associated with it. So, in our case today, we're going to imagine that a fellow is in a busy orthopedic clinic, and they're covering a patient caseload of a physical therapy assistant who is on vacation. The issue? A fellow discovers that the PTA has been routinely performing manipulation techniques that fall outside the scope of practice defined by the state practice acts and, crucially, the APTA standards and position statements regarding the use of PTAs and specialty interventions. The fellow is ethically bound by the APTA Code of Ethics as well as the position statements from the AAOMPT Association, which raises the concern to the clinical director. However, the clinical director is a close friend of the PTA and dismisses the concern and labels the fellow a difficult person, creating a hostile environment and potential retaliation issues. Caught in the middle of this dilemma is a student physical therapist observing this ethical breakdown within the clinic. The student recognizes the patient safety implications and the breakdown in professional conduct, but is unsure how to report the issue without jeopardizing their placement and the universities. The scenario forces us to really ask what professional boundaries are blurred by professional relationships? Where does the fellow's ethical duty truly lie? And how can we support those when they do speak up? So, with this case, I'm joined by two other fellows, uh, Dr. Mary Beth Geiser. Mary Beth, you want to introduce yourself?
Thanks so much, Chris. So my name is Mary Beth Geiser, and I'm presently the president of the Academic and Clinical Faculty SIG for AOM. And I've been in this role for a little bit over a year and a half. And it's been interesting to be able to see how academics and my fellowship and past experiences just in the clinic all came to light when we started talking about the inception of this podcast. So I'm just glad to be here. And as a clinician and an educator, both part-time and mom and colleague, it'll be good to see how all this shakes down. Thanks so much for having me.
Absolutely. And Dr. Paul Loneman.
Hi, I'm Paul Loneman. I'm an AAOMPT fellow and a member of the Practice Affairs Committee and also APTA Indiana president. So it's great to be here and let's get talking.
So, when we look at this through the fellow's eyes, since this is kind of something that we've all kind of adopted and want to support, um, what do we think are some of the chief ethical standards that we're bound by that you think that the fellow is kind of coming up against? What would you say are some of the most prominent ones?
So there's lots enveloped in this related to professionalism and respect um, for other practitioners' autonomy. Um, and practice decisions and the other therapist that was working with the PTA at the time. So
Yeah, and a
could
lot
be
of that would depend, right, on the State Practice Act, right, in terms of what is laid out, in terms of what's allowed and not. But however, with a fellow, we're kind of held by these additional standards that we're looking to uphold in terms of ensuring that um, the patients are getting the highest quality care in terms of from fellowship, especially when we're looking at manipulation. And then, so when you really look at it, I mean, they're really, I think you're highlighting a lot of the accountability aspect,
Mhm.
right? That they're really trying to uphold, what they should to themselves as well as to the patient, which is really best. Um,
So let me jump in here for
yeah,
a second, if that's okay. Right. I love that you brought up accountability because if I had to look at maybe the top two that just would get this conversation started, I would say accountability and integrity are the top two. Right. So you made a nice lead in to me. We're accountable. We're fellows. That's why we picked what we picked for our area of study. Right. But it's the integrity of being a fellow that I think we could start this conversation off with because you're like, just look at the words that are in that definition, right? We're going to fulfill the mandate to address a known problem. Like that's what we have to do. We want to bring that to the light. Now, we're not the one that's maybe even going to bring the PTA and the PT into the room, but as a fellow covering for that day, I do feel it's my integrity to mention that. So let's say I do that. And then you, like you said, Chris, I'm accountable for the fact that I know something happened. Okay, so if we start out just a conversation from that way, I would have to decide. I'm in Wisconsin, you're in Indiana. Chris, you're practicing somewhere else. Now let's put on our state practice act on top of that. We might have actually more than one accountability problems that we have to discuss. But by not bringing it forward, I don't even have the integrity as like my number one professional ethics issue that I think should just at least be talked about in this situation.
Um, so I agree. I think these are the two kind of big pillars that the fellow has really encountered with this scenario. Um, and another one of the kind of reshaped standards that I think kind of fits in is this responsible business operations, right? And so when you read that in an ethical kind of title there for a standard, I think that can be perceived different ways, right, by all the different stakeholders as we look at it. But when you really look at the kind of the more definition, looking at these truthful practices that they're looking to support, in reality, the fellow is really trying to support the business to ensure that they are operating and functioning on a plane that we would expect, that the public would expect providers, especially healthcare providers, to behave by. Um, however, that could be seen other ways, right? In terms
Right.
of, well, this patient's expecting manipulation. So I'm seeing this other individual as a PT assistant. They're going to be expecting some manipulation. So in a way, um, that does maybe impact the patient's perception of the care that they're getting. So how do we manage those situations in the clinic? When you think about this person coming in, receiving care, they've just started receiving manipulation and, the change of schedule. And so now they're with the PTA. Now they shouldn't be in the PTA, seeing other manipulations happen and kind of wanting to do certain type of techniques. Um,
Paul, you and
does
I
it,
could talk about that
yeah.
from a educational standpoint, right? Because those students could be in our office the next day and bringing this forward. So, as someone working with the ACF SIG, we'll get these calls once in a while, or email sent, or someone contacts me at the conference, and we'll talk about maybe the student was the one that was uncomfortable with this ethics situation that was there. So, we have to teach our students, like, if I set a good example, they're going to be able to come forward with a situation. So that responsible business operations, that student might have recognized Chris the situation just as an observer in that part and looking to the fellow to set the example. So let's just pick a one word out of that definition of like, you got to be congruent with your credentials. Like, what does that mean if we're looking at responsible business operations? And Paul, you can jump in here, after I'm done. But I would tell the student, this is where my congruency is different than the person who was treating before I was there. So we have the PT and the PTA from before, and that's a linked pair, right? Then you have the patient coming into that area, like you said, with expectation. I come in there and I am not congruent with that situation. I don't fit. My ethics don't fit with what's going on. So if I was there and I found myself caught, the first thing I would do with the student is be like, let's put on some hats here. And I'm going to stick to my congruent hat as a fellow. In the deepest of dives into all of this, I would put in front of the patient, did you realize I feel uncomfortable here? I have something that I don't think I fit with, and I got to bring this to the light. So if I brought it up in a very casual way that like this is on me to bring it up in the situation because I'm uncomfortable, then maybe it'll kind of water down the tension that's in the room about what the patient, like you said, Chris, might all of a sudden be recognizing something's not going to happen to me today. And I'm trying to find out what's up. Because I would then potentially decide if the manipulation is appropriate, I could administer that, correct? That's congruent with my line of practice. My process for responsible business operations is I am the highest skilled person in the room to apply that. The ethical dilemma comes in is how do I tell the patient that the person who did manipulate them last week really shouldn't have, right? So that's how I think the
No,
integrity
Yeah.
comes full circle. So I'll let
you,
you guys comment on that one.
no, I think you raised a good point because the idea that this is an ethical issue as a result of someone trying not to disappoint the patient, right? So it
Mhm,
doesn't come from a point of like malice or, you know, necessarily negative intent, right? So these
mhm,
issues can come when people are trying to do what they think is best in the moment, but it can still be a violation. You know, for the PTA's desire not to upset the patient ends up upsetting a lot more than just one individual. Ends up,
mhm,
creating tension between the fellow and the clinical director, the student. Now the clin ed team is going to get involved as a result of having to now deal with another. So it has this trickle down effect when you look at it. And so really, it's almost a failure of the business operations set up in terms of how they're orienting their patients to how their care can be kind of stratified within their practice. And
mhm.
so as a result of that kind of getting up front with it, it ends up having these like trickle down effects. Um, Paul, have you seen these types of business operations or ways in which practices can get ahead of some of these ethical issues?
So yeah, the well, I was going to bring up another point related to that. It's another component is the compassion and trust part of the code of ethics because like you had brought up, the PT student is in a situation where they have this issue and that the compassion and trust related to now you may have lost the trust of the patient. Um, the PTA has lost the trust of the PT. The director has lost the trust of
Mhm,
possibly the PT, and now they have to address from a compassion standpoint how to explain this to the PTA if they become in agreement with what the fellow is saying, or maybe they didn't recognize that that was an issue. Um, and ultimately this is a breakdown from a business organizational process that this wasn't discussed before. You know, the a friend of mine would tell his students frequently, the essence of conflict is the lack of disclosure. And so this is a conflict because all these parties were not aware of um, what the protocol was for this, and it wasn't discussed. Um, Part of that is the accountability of the fellow when they're getting ready to go on vacation. They may not have been there that long, but if they're working with their patients, saying, hey, in my plan of care, I have manual therapy listed as this, and part of that has to do with the organizational process of typically you have a drop down in your documentation. You say, I'm going to do this. I'm going to do manual therapy. The therapist may have been used to working with their difficult patients that need more manual therapy. They may have been used to treating their own patients um, and co-treating with some discussion with the PTA. Whereas other therapists in that organization may have said, here are your patients for the day. So, what's the setup or the process? What is the role of the PTA within that organization? And how does everybody fit in a team? So I think it's also to some degree the fault of the fellow to not ensure that what they feel like is best for their patient is going to be occurring when they're gone. So, um, I think that's all interrelated within the
Mhm.
business organizational practices that um, the fellow um, has to be on their game to say this is what I would expect to be happening, or a PT that's not a fellow, the same thing. So yeah, I probably made it a little more murky with this discussion answering that question, but I just wanted to fill in some of those other things. Now, if you had the standard of conduct in front of you, there's 9 blocks there, and this is really trickling through all of them, you know.
No, I mean it's
So
an
Chris, how
excellent
about this?
point. I
Go
mean
ahead.
it's
You go first.
I'm sorry, yeah, it's an excellent point just how murky these ethical issues can be, and they're very individualized based off of the state. But yeah, we as fellows are bound by beyond the APTA Code of Ethics, but also our position statements. And yeah, you're right. We check that box, every December when we, re-up our fellowship. Mary Beth.
Yeah, so I'm just going to put one last little twist on here, and then you can decide if this should tangent off to something else. Both of you had mentioned that potentially the people in the room are not members, PTA, PT, things like that. So I'm going to bring up one little concept of this. So if they're not members, are they blatantly ignoring what is out there and known, or are they just blissfully ignorant? Okay. So if they're blissfully ignorant, the things we just talked about, our integrity, our accountability, and our business operations, it's our duty to tell them that this might be out there. They're just blissfully ignorant. It could be as simple as that as an ethical solution. Okay. It's the blatantly ignorant that sometimes gets to be the tension building and the power, you know, that kind of like power struggle in the clinic of who is the smartest in the room or who is the one that's really in charge. So I think as a fellow, we are good at problem solving. We're good at analyzing the complex. So just taking one step back and even just trying to see if the situation is involving ignorance or ignoring, it could be a big difference in how this whole thing shakes down.
For sure. It's just the kind of piggyback off of that. I mean, I think this is what, when you think about the student and then if the university is aware, like this is what makes universities want to set up these relationships with clinics that have fellows because of these standards that we have, that they know that there will be, this relationship with higher level care, higher professional develop, lifelong learning that'll be there, and that's what we want all of our students. From my view is, in academia, that's what we're looking for, and I think clinically, it's just like customer service, right? It's always a relationship business, right? So even if there is a negative experience, we understand that that's always going to be the case, but I think it does afford the clinic an opportunity to really highlight how well they can navigate ethical issues. And even if there is an initial, ethical breach or ethical problem, if it's resolved in a very constructive way, it can still look very good upon the clinic. And in fact, continue that relationship with the university. Because I feel like often there's this kind of, everyone wants a nice facade up front with everything looking great. But that's not the way, our
Mhm.
practices go and every day with patients and each other. And so it really is, I think, and highlights that, you don't want to just take these ethical issues and kind of shove them under a rug and ignore them. We want to pursue them to ensure that we're upholding the standards that we've set as a profession. I often think about the skills that we're really talking about is really this development of the leadership skills.
Mhm.
And it's not really like the number one reason why people will go in to become a fellow, right? They want to get better with their hands-on, their psychomotor skills, their clinical decision making, their reasoning. Um, when you really look at the impact the fellowship has, it really does just catapult you into more of this leadership kind of role in these responsibilities, because it just becomes innate in terms of what happens as a result of the process, in terms of your role in the clinic, in terms of your awareness for evidence-based practice, in terms of being more patient-centered, integrating evidence. So it really, in a way, as a byproduct, does put a lot more onus on us, and it's reflected in what these ethical standards that we have from APTA as well as from AAOMPT. And so um, I think it's something that, as you kind of were talking about the conferences, Maribeth, like I
Mhm.
feel that, right? Every single time I
Yes.
feel like I go to a conference, yes, there are, different techniques and evidence that are there, but it's really the passion and leadership that really becomes a little bit more infectious as we go through. And I think that shines when we talk about these ethical issues. And, that's one of the things that um, I think it's important as we kind of talk about some of these issues and different scenarios that may come up, that they really kind of resonate with the responsibility and the kind of aspirational goal that we have with all of our fellows in training to be leaders in the field. And it's beyond just evidence and techniques and in the community, but also in the profession, getting involved, making it more known, what
Yeah.
um, we expect from each other as we go through.
I'll ask Chris, he'll be able to answer this is when we were developing this podcast, one of the things we're trying to just get get fellows to understand is how do they even know how or where to report the problem to, right? Or what is the process? So maybe you could speak to that because Paul just like led right into that question. I'm just going to let you answer that one. That's your area
Yeah,
of
I mean,
specialty.
first, I mean, the student reporting it to the university, right? It's obviously going to be their kind of role. But then when you think about the fellow, um, reporting it, there's a couple areas that you can report out to. Reporting out to the AMPT office, to say, hey, this is kind of what I've been seeing, and oftentimes, we will field those as a committee, and our role is almost like we've been doing, for the past hour or so. It's just to educate, make sure that everyone is aware of what's going on, you know, um, because that's very important to our membership, is to make sure that we are held to those higher standards. So we kind of field those, and then there's a more of an educational bend on most of the issues that come to us. However, when there are more egregious ethical issues where this isn't, individuals seeking to get some clarity on a condition or an issue that's going on, they would need to supply specifics as to which one of these standards, of these nine kind of basic standards they see from the APTA Code of Ethics, or some of the position statements that we have for AOT, and then evidence to support how that was violated by the fellow. This situation was obviously the fellow was advocating for those rights. They didn't necessarily
Mhm.
violate any of them. So this would be, if anything, just educational to the clinic, where we would, supply some resources to kind of orient them to why this fellow was doing this, so they weren't being a difficult person, in terms of as they go through. And then there's obviously the APTA Ethics Committee as well, that fields it on their side. Um, of things. So there are means in terms of reaching out. We often feel like these things are underutilized and not reported as much. When in reality, the ethics of both these associations, or academy and the association, is to really educate members, increase awareness for certain issues, to reduce conflict, to promote what we do as professions. So um, when in doubt, you can always just kind of reach out to the AMPT office, and their contact information is on the website, um, and that tends to be what we do on both sides, whether the association or for the academy. So great. So, well, this has been excellent. I mean, obviously, there's a lot of big ethical issues here. I think they're, like we talked about just now, they're underreported, but they certainly impact almost every person who sees them. And, I think when we look at fellows, they are true leaders in the clinics and communities that we have. And so it's really great to see that we all kind of can see that in our different little spheres that we have in terms of how important that is. I do want to thank you both for joining me on this podcast. Mary Beth, thank you so much for your insight. And Paul, again, thank you. Yeah, your view from an
Mhm.
academic side and leadership side through your state chapter. Thank you both very much. Any parting words?
I'm just
Well, if,
thankful for, go ahead, you go first, Paul. Sorry about that.
well, if you haven't noticed our logo, and why are we floating in the Niagara Falls is remember that in Buffalo, November 11th through the 15th, we're having our next conference. So we'd love to see you up there, and let's connect.
That sounds like a great plan because I'm hoping that this one podcast just stirs a conversation. And maybe the three of us can meet again because a fellow out there actually supported another situation and we could comment on that the next time, right?
Excellent.
Sounds
So
great.
thanks for having me. I appreciate it.